Hello everybody, I am Lefika Leon Risheng. I'm a medical student from Botswana.
Hello, my name is Pokam Fenuonela. I'm a fifth-year medical student from the University of Boya of Cameroon.
It's quite a great experience so far. The conference started yesterday and I've learned a lot. I'm just from a workshop about non-communicable diseases in Africa. It's helping me to think about ideas and innovative ways in bringing these NCDs down.
We all know that as medical students we have the voice of tomorrow. We need to emphasize on our leadership now, and this is the place where we can build those talents and devise our strategies towards fighting the challenge that we all have.
I arrived in Nigeria on Saturday, and ever since then I've been having a good time.
I'll now be calling on our first speaker, Professor J.M. Dango, a renowned and internationally recognized researcher and academician. He's the team lead of the World Health Organization NCD's prevention program, to give us a short presentation. Thank you.
Good afternoon, colleagues. I'm very honored to be with you this afternoon, part of the discussions around repositioning healthcare in Africa for sustainable development, and more specifically to discuss NCD burden and how should we take a quantum leap to address this threat in our region. My presentation will be in three parts. The first one dealing with the burden in the region. The second part, the response so far. And I will conclude with what we think should be the way forward. Bear with me, this presentation will focus on global and regional matters. I will, times to times, deep in Nigeria. So, non-communicable diseases is a group of many diseases, and as introduced by the moderator of this session, there are 4 of these groups which are recognized at global level as main NCDs. It is cardiovascular diseases, the group of cardiovascular diseases, cancers, diabetes, but also chronic respiratory diseases. They have been recognized as main NCDs because they are the leading cause of NCDs death worldwide. These deaths occur most of the time before the age of 70, and they have been characterized as premature deaths. NCDs, particularly these 4 main NCDs, share 4 main risk factors, namely tobacco use, harmful use of alcohol, physical inactivity, but also unhealthy diet. Among these 4 main NCDs, cardiovascular diseases account for most deaths, followed by cancers, chronic respiratory diseases, and diabetes. The group of cardiovascular diseases is responsible of almost 82% of all NCDs deaths. We should be informed also that almost 3/4 of NCDs occur in low and middle income countries. And the burden falls mostly on nations already grappling with communicable diseases and which are the least resource to fight the disease. There is a wide variety of the probability of dying from NCDs before the age of 70 between countries. If you look at countries from our region, there are some of them which are with a very low rate of dying from NCDs, but also others are in the very high rates. Those with low rates are around 14% of probability, while the ones with the highest risk are around 30 to 32%. The African region, what we call the African region, is composed mainly of 47 sub-Saharan countries, along with Algeria. The burden in this part of Africa will increase, and by 2025, it will become the major contributor of mortality if the current trend is unchecked. And this trend, the current trend of NCDs in our region, is hampering the socio-economic development of the countries. We are faced with a double burden of diseases. We didn't finish with the agenda on communicable diseases. We just heard the panel discussion around communicable diseases in the region, and now there is that epidemiological transition with the increase in non-communicable diseases in our region. This graph is showing, sorry, can you go back? This graph is showing the proportional mortality due to those NCDs in both sexes in many countries in our region. The light blue, sorry, I will let you know when you can change. Come back. Yeah. The light blue represent deaths due to NCDs, while the black ones, the black blue, represent deaths due to communicable diseases. And as you can see, in many countries on this graph, countries which are in West African region, there is a raise in the mortality rate due to NCDs. The same, as you can see here on the upper left, for countries in the southern and eastern region, while the graph in the corner, in the right corner, represents the prevalence of raised blood pressure in countries in our region. As you can see, the line draws what's happening at global level, the average at global level. And most of the countries, including Nigeria, where you can see it has been highlighted in red, we are above the global average. Next, please. On this slide, I tried to put a few data on the risk factors for NCDs. The two first are related to tobacco smoke, tobacco use, and as you can see also, there are countries with high prevalence of tobacco use. On the first graph, you can see where Nigeria is seated. It's around 12% prevalence of tobacco use in Nigeria, while in other countries, it's more than 27%. On the graph below, it's the harmful use of alcohol. And there, Nigeria is part of the top 5 in the West African region. Next, please. So there is another graph here on the right-hand side of the slide where we can see what's happening in Eastern and Southern Africa. Yeah. Next, please. The burden of NCDs also falls on women, as you can see here, when it comes to diseases, cervical cancer, hypertension, but also risk factors such as overweight, physical inactivity, and tobacco use. Next, please. So there is, unfortunately, a vicious cycle between poverty and NCDs. And no, please, come back. Yeah. As you can see here on the, for me, is the right-hand side of the slide, how the people in the countries are losing their household income because of NCDs risk factors and also because of the diseases. So when you are poor, you are more subject to deal with NCD risk factors like tobacco use, like unhealthy diet, like physical inactivity, like harmful use of alcohol, and this will lead you to the loss of your household income. And after you are faced with NCD risk factors, you will, in the long run, get the disease itself, and you will again lose your household income to get treated. You will also lose your household income because of premature death. And this cycle is a vicious one, and it will continue like that. In 2011, WHO and partners estimated the cost of inaction. If we do not tackle NCDs, we will lose around $7 trillion between 2011 and 2021. While if we take actions to address NCDs and the risk factors, it will cost the global community only around $170 billion. So I think here the picture is clear. We need to take actions. Next, please. So based on that, in 2011, there were the first ever UN General Assembly meeting, what they call the high-level meeting on NCDs, during which head of governments and head of states adopted a global declaration, a political declaration on NCDs, committing themselves to address NCDs and their risk factors. And this momentum has continued since then. And as you can see on this graph, from 2011 to 2018, there were several global meetings during which our leaders went and committed. But unfortunately, these commitments were not all the time followed by appropriate actions. Next, please. One of the commitments to be part of the response was to implement a multi-sectoral approach when dealing with NCDs. We realized that tackling NCDs goes beyond the health sector. For example, if you take tobacco use, if you want to address tobacco use, you have to work with the Department of Trade, you have to work with the Department of Justice, you have to work with the Department of Communication, and all those departments in the government should be put together. We have also, in addressing NCDs, to work with the private sector. The public-private partnership is very important at national level, but also at international level if you want to deal with NCDs. We have to work also with civil societies, NGOs, international NGOs, faith-based organizations, CSOs, all relevant organizations should be taken in board when dealing with NCDs. And last but not least, UN agencies with the strong capacity of conveners. They can make strong advocacy. They can even support technically. And you have here a list of UN agencies which are all involved on NCDs. Next, please. So in the response, and based on the commitment made by the world leaders to reduce the premature deaths from NCDs, we identified 5 key elements which are integral to an effective multi-sectoral coordination mechanism. If you call several sectors to work together, we should put in place a very strong coordination mechanism. And here are the elements you should build on to have this strong coordination mechanism. We need a high-level political leadership. We need clear scope and mandate for all the participating actors. We need a strong secretariat and sectoral focal points. Most of the time, the secretariat is handled by the Ministry of Health. We need a costed joint work plan and earmarked funds. Those earmarked funds should be given by the country. And we need also robust accountability indicators. I also put here on the same slide the 5 key strategies to improve the involvement of relevant sector, all linked to this multi-sectoral approach. We need to set a political agenda. There was yesterday a lot of discussions around political choices. So this is very important. We need to generate evidence to make the business case. And the generation of evidence is something we should count on you, medical students, to provide. We should also showcase benefits and share responsibility, ensure joint accountability through process indicators, and we also require periodic reporting to a supra-ministerial body, supra-ministerial authority. Don't forget, it's a multi-sectoral approach. It's not only the Ministry of Health, other ministries are involved, so there should be a body, an authority which has supra to all those government departments. Next, yes, next. So for the response in 2011, after being mandated by the UN General Assembly, WHO has issued, and it was adopted by the World Health Assembly, a global action plan for the prevention and control of NCDs for the period 2013-2020. And this action plan has a monitoring framework in which 9 voluntary targets has been defined. And here are those 9 voluntary targets. There is an overarching target, which is to reduce by 25% premature deaths from NCDs by 2025. Other targets are related to risk factors, and you have also some targets related to the performance of the health system. Next, please. So this was in 2013. In 2014, global leaders met again and committed to these 4 time-bound commitments. They decided by 2015 to set national NCD targets for 2025, but also 2030, based on the 9 voluntary targets I talked about a few seconds ago. They decided also by 2015 to develop national multi-sectoral action plans for NCDs. By 2016, to implement what we call the best buy interventions to reduce risk factors, but also by 2016 to implement best buy intervention to strengthen the health system when it comes to NCDs. Next, please. So here is the document where you can find these best buys. There are 16 best buys, but also in the document, the best buys are interventions which are cost-effective, which we can implement at population level, and which are affordable. We can implement them right now in our context in Africa. But also in the same document, you have 72 good buys. So these interventions can provide effective impact, but the cost is not as cheap as we think. Next, please. There was also a study which has been made to see what is the economic benefit of implementing these best buys. And as you can see here, 2018 is the year zero for it. If we implement best buys, the package of 16 best buys, it will cost us per person per year around 0.49 US dollars. The economic benefit for that will be around 1.35 US dollars in 2020. In the long run, if we reach 2030, it will cost us 1.27 US dollars to implement the package per person per year, and the return on investment will be 14.27. So I let you have your idea on the implementation of the best buys. Next, please. When preparing the 2018 high-level meeting on NCDs, we assessed where we are with regard to the implementation of our commitment. And we asked ourselves 4 questions. Have countries strengthened their capacity to address NCDs since 2011? The answer has been yes. Have there been improvement in NCD health outcomes since 2011? Here the answer is yes, but are we on track to meet the commitments made at the UN General Assembly? The answer is no. And are we on track to meet SDG targets 3.5, the one related to NCDs, by 2030? Here also the answer is no. So our 2 leaders in the UN, starting with WHO DG, Dr. Tedros, said the world has yet to fulfill its promise of implementing measures to reduce the risk of dying prematurely from NCDs through prevention and treatment. And the UN Secretary General, Dr. Guterres, added, it's crucial to reach agreements on new strategic course and approach to support countries in implementing the best buys for NCDs. Next, please. Next. Here is where we are when it comes to our region. There were also a series of indicators. There were 18 indicators, and when we distributed the attainment of these, the achievement of these indicators against the countries, we can see that 13 countries in our region achieved fully achieved only 1 indicator. 5 countries fully achieved 2. 10 countries fully achieved 3. 1 country achieved 9 out of the 18. You can see that we are very far from achieving the indicators we set at the beginning. Next, please. Next. We know we have a clear vision on what to do, particularly the response at country level. And this response will focus on 4 main components: governance, addressing risk factors, health systems to deal with NCDs, as well as surveillance. Next, please. There are a series of obstacles in the implementation of our commitments. These obstacles are related to political choices, to health systems, to national capacities, financing, but also to the impact of economic, market, and commercial factors. Next, please. Next, what is the way forward if we need to take a quantum leap? First of all, we should allocate commensurate resources to the fight against cancer. And when I talk about resources, I mean financial and human resources. With regard to finances, I showed you what should be invested per person and per year. We should develop and implement, monitor and evaluate integrated national multi-sectoral plans. We should also develop scale-up cost-effective NCD prevention and control intervention, mainly focusing on best buys. We should implement and scale up also cost-effective healthcare interventions at primary healthcare if we want to reach universal health coverage. So I thank you for your attention.
Thank you very much, sir, for that brief introduction. Please, you may have your seat. Thank you. So I'll call on the rest of our panelists for today. The first I'll be calling on is Mr. Ayobamigbe Faluyi. He's the co-founder and Director of Research and Development at the Wellbeing Initiative. The Wellbeing Initiative is a youth-led organization passionate about the burden of non-communicable diseases in Nigeria. I would also call on Mr. Arishe Temitope. He volunteers with Project Pink Blue, an organization that has served as the voice of cancer advocacy in Nigeria. It's a member of the World Health Organization's Partnership for Maternal, Newborn, and Child Health. Thank you very much. It's a good thing we have young people here to discuss this topic, since this is a youth, it's an event for young people, and we're discussing issues that affect Africa. So while Professor was talking, that was Professor JM, he mentioned some risk factors for non-communicable diseases. I'd like to pose this question to you, Mr. Temitope. What do you think are the social-demographic factors that could be affecting our region in having such a great burden of non-communicable diseases?
Okay, thank you very much. Some of the risk factors as stated by the professor include smoking, using the tobacco, physical inactivity, and excessive use of alcohol, and unhealthy balance. Okay, so some of the social factors that could that are that are the ones causing these risk factors include poverty. The increase in poverty in some African regions, some African countries, has been the cause of these risk factors. Take, for example, so many people are depressed by being impoverished, and they take into excessive use of alcohol and smoking of tobacco.
What's your view, please, Mr. Ebambe?
Well, as said by my colleague, the social and economic factors are majorly poverty, the vulnerability of some gender, to be specific, that's women, and majorly the health system also has really helped to allow NCDs skyrocket. Hello? Okay. Then, of course, the business part of our socio-economic environment, which allows for the drive for profit at the risk of endangering several human lives, is also a key factor why NCDs are thriving. I mean, if we have the evidence that tobacco kills about 7 million people in the world, what should make any nation or any people to allow such to be sold or to even be produced? But unfortunately, we are in a system where for-profit agenda is more superior to securing humanity and achieving a healthy community. So the same thing goes for alcohol. I think these are major barriers to achieving the reduction in the prevalence of non-communicable diseases in the world. Yeah.
Thank you very much. So, Mr. Arishe, while you were speaking, you spoke about the fact that poverty underlies a lot of non-communicable diseases. And we know that many African countries are impoverished. So, do you think we can realistically reduce this risk since poverty is so prevalent?
Realistically, I think we can. Because one of the problems we have in this part of the world is our political will. If we have good leaders who can implement the best policies as they attend the World Health Organization's forums and assemblies, there are so many resolutions made, but yet bill implemented. So I think these factors can be reduced and can be curbed if our political leaders are willing to enact on the policies that are being deliberated and delegated to them at the assemblies they attend during the WHO and the UN General Assemblies.
Thank you very much. So while you were speaking, Professor J.M., you spoke about the gap, the global action plan to ensure that the death from non-communicable diseases reduces by 25% by the year 2025. So how far have we really gone? Do you think it's possible that we meet that target?
Thank you very much, Zainab. I think the first assessment we did when preparing the last high-level meeting on NCDs showed clearly that we will be able to meet that commitment. As I said it during my presentation, but perhaps I went quickly on it, there are some underlying factors which are very difficult to address. Those underlying factors are globalization. Today, if something occurs in New York in the morning, it will sleep in Ibadan in the afternoon. So people to say that the today world is a village. So those bad habits which were in the developed world are nowadays here, because of global trying to live westernized lives today. So that's something very important we should take care of if we want to meet our target. Second, urbanization. We are all running to urbanize our countries, to urbanize and making these big cities where unfortunately poverty is there. All the NCD's risk factors are there. Let's say we are talking about poverty, but also wealth is a risk factor for NCDs. We have our kids going to school 500 meters from where we live, but we will take them by car, drop them at the entrance of the school, go back and collect them at the entrance of the school instead of letting them walk. We are also having an increase in life expectancy in African countries. And we all know that NCDs are diseases occurring most of the time in aged populations. So these factors, as you said in your first question, are related to social, economic, and demographic factors. With regard to the risk factors themselves, yes, two ways, two strategies to deal with them. Individual strategies, asking for a change in behaviors individually, as well as strategies targeting population at a whole.
Thank you very much, sir. While you were speaking, you mentioned that we have people living longer now. And that means we have a lot of young people as well, because the young people are people that will end up becoming the elders in the future. So, Mr. Ayobamibe, in your work with young people in tackling non-communicable diseases, what have you been able to achieve? Understanding that Africa has the youngest population in the world, is there something we can do in harnessing that number we have in tackling the burden of non-communicable diseases?
Well, they said we're always bigger together. Of course, having, like Nigeria, for example, we have about 65% population being very young, and that is expected to grow over the years. So definitely, this case of NCDs is actually about us, because that means the nearest future, we are going to be the ones they are talking about when they say there's prevalence of NCDs in sub-Saharan Africa. It's going to be the young ones. So that makes us a big stakeholder in curtailing the increase of NCDs. So definitely, that's the big task before us. And in our own little space, we've been able to tackle head-on some of the factors that we think would help the young people to be able to reduce NCDs in the nearest future. Now, I'm talking about empowering ourselves with the available evidences, knowledge about the NCDs, be able to improve our health literacy about this issue. Then also, we should be social activists about this whole case. Well, we've been quiet for a while, but we need to step out of our comfort zones, because it's about securing our future. NCDs is going to ruin the population, the young population of Africa in the nearest future if the young people don't take action now. So we need to come out of our comfort zones. This is our fight. Now shisha is everywhere, being smoked. You may be comfortable with cigarettes. Somebody may hide in the toilet to smoke cigarettes. But when somebody takes shisha, the smoke is everywhere. And it's going to affect even a passerby. So these are the issues for us. Improving our health literacy on this issue, holding government to be more accountable, make them more committed to the health sector, improve the finances of the health sector, help us with our health system. Of course, we have the energy, we have the numbers. We should be doing more about it. And I'm so confident about the fact that we can actually do more. Yeah, thank you.
Thank you very much. You spoke about the fact that the cost of healthcare is going to, there's a problem with the cost of healthcare in terms of people having to pay out of their pockets. So I understand that the Project Pink Blue, that's to you, Mr. Timtope, worked last year on trying to make sure that the National Health Insurance Program covers more chemotherapy drugs, because cancer, we know, is one of the leading causes of death from non-communicable diseases. How far were we able to go, and how much more can we do in ensuring that the government takes action in terms of funding healthcare in our country?
Okay, in Project Pink Blue, won a grant from SPARC through the Union of International Cancer Control, and set up a more like a club that's advocating for cancer patients, and the cancer treatment be inculcated, be included into the NHIS scheme. And works are ongoing on including cancer treatment in NHIS scheme. more reason why Project Spin Blue is evolving young advocates to be, young people to be advocates for NCDs, because we need ambassadors of NCDs to make social awareness. Not only the awareness, but advocacies, because there is a difference between awareness and advocacies. We've done a lot of awareness, but little of advocacies. So we need to push more to get the government involved in the treatment of NCDs, especially cancer.
Okay, yes, at the Wellbeing Initiative, foremost that the Wellbeing Initiative is the first community of young advocates against the risk factors of NCDs. So we've been able to do a couple of things in the past 1 year of the existence of the organization. We are head-on with advocacy and, of course, social engagement with stakeholders, Ministry of Health, civil society, the media, and of course, citizens. We do community interventions, advocacies. So basically, that's what we are facing, a young community of NCD advocates. So you're welcome to join us.
Thank you. Referring back to our earlier discussion this morning, since it's a continuum, we know that there are a lot of vertical programs that are tackling infectious diseases at the moment. We have APIN, we have PEPFAR, we also have some other programs like the IMCI tackling other maternal and child illnesses. Are there ways of incorporating are there ways of incorporating NCDs into this program, for instance? Professor Jeff.
Thank you very much, Zainab. Allow me to come back on one of your questions for me, which is of paramount importance. The place of the youth in preventing and controlling NCDs. First of all, we have recorded that childhood obesity is on the rise in our region. And also, the youth is the segment of the population where NCD's risk factors are the most common. If you take an healthy diet, the youth prefer eating processed food, going to those fast foods. They are the ones dealing with chicha, cigarette use, and other form of tobacco products. They are the ones using harmfully alcohol. They are the ones with less physical activity. And that's really unfortunate. At this time, we are already experiencing a rise in the NCDs. And if the youth is also gathering all the NCD risk factors, that means that in a couple of years, it will be a real epidemic in our region. So, as this meeting is a meeting of the youth, of medical students, I would like to make a plea, to make a call to all of us, all of you medical students. You need to be the champions for NCDs prevention and control. I would like you to commit individually to live healthy lives. For those who already smoke, please stop smoking. For those who are using alcohol, the same. Stop. please have a healthy diet, meaning you have to consume more fruits and vegetables, less sugar, less salt, less oil. You should also be better informed and teach by example in your family, starting with your family. In your community, I mean your village, your university community, but the community at large. You are the decision makers of tomorrow, so you have to be better informed so that you will be able also to make informed and useful decisions. And as a group, as a medical student association, as a medical student federation, you also need to gather the evidence, you need to advocate and influence policy choices in your countries, you need to be the implementers as medical students, but also as the physicians of tomorrow. And as implementers, you should not forget about prevention, you should not forget about promotive measures. Don't focus only on clinical management of NCDs. You have to close the tap instead of whipping the floor when the tap is not well fixed. And lastly, I would like you to be the watchdog and make all the push you can for decision making at national level.
Thank you very much, sir. Please, are there any policies that we can borrow from international communities to make our fight against the burden of non-communicable diseases more realistic?
As I showed in my presentation, at global level, the global community has already committed. They have shown the evidence of what works. It's now our duty to contextualize it. It's our duty to domesticate it. I heard this word several times since yesterday. And unfortunately, the international community is not providing financial resources. You talked about PEPFAR, you talked about other big donors at global level, but we need now to go for an integrated approach. When money is given for maternal health, we do have NCDs which are hampering the life of our mothers, of kids. So you can add to your program, your maternal health program, breast cancer, cervical cancer. You can also add diabetes during pregnancy. So there are a lot of ways of integrating NCDs in other programs.
Thank you very much, sir. So, Mr. Ayabamigwe, what has driven your passion for non-communicable diseases? Is there an advice you'd like to give us as medical students and young people here, to help us also get so interested in non-communicable diseases besides the obvious?
Well, I'm sure that I'm sure that all of us actually have maybe close or distant family members who are to non-communicable diseases. I'm sure about that, and this is enough reason to drive us to make the change that we need. And coming to think about it, the elders that we have currently, they are going to leave us with the burden of this disease. And it can never be, it can't be about us without us. So it's really a call that we have to step into these shoes as quickly as possible to stop the increase in non-communicable diseases around us. So I challenge us all to please, because if you look at it, we are actually the ones that have access to all of the information that we need to empower ourselves. All that is needed is just action. If all of us in this room declare tomorrow that we want the state government to do something, I'm sure that it's going to go far. So we need collective effort of the young people. We need our energy. We need the innovations that are embedded in us. We need all of this on the table to fight this big issue. Thank you.
Thank you very much. Mr. Arish, is there something you'd like to add to that?
Okay, I would just like to add to what he said the other time concerning the information at hand. I would probably just say there is probably none of us here that do not have one social media account or the other, most especially Twitter. And it has proven to be one of the most powerful social tools. Twitter has been the most powerful social tool, and we cannot but accept the fact that we are the only people in the world, the young people in the world, that can push the information concerning NCDs and the risk factors. Because if you can be able to stop the risk factors, I mean to alleviate the risk factors, we will be able to stop the incidence of NCDs. We're not talking, when we're talking about NCDs, we already know what NCDs are. So we especially in the area of cancer, we do not really know the causes of cancer, but the risk factors are present. And we need to always let people know the information are not being disseminated well enough. I think so. We need to let people know that even if the information are well disseminated, we need to keep on hammering on it. Because despite the fact that people are we have been told that the risk factor is smoking, we have a lot of educated, literate young people still smoking, still partaking in shisha and all stuff like that. And it's a call for us to go out there and keep hammering on the information we have at hand, that smoking has to be stopped, excessive use of alcohol has to be stopped. We have to involve ourselves in physical activities such as exercises, the use of gyms, and we have to inculcate the habit of balanced diet. Thank you very much.
Picking on what you just said now, now we're saying exercising because we're in this part of the world, we're in the city, but many people actually still live in rural areas where they can't really jog because the roads are not, the facilities are not available. You can't be jogging in muddy water or by the bush. So what practical things can we do? And then also, social media, it's because we have phones that we can be on social media. We still have people that use phones that are not Android or iOS enabled. So do we have to go down to those places to enlighten them? What more can we do as young people to make sure that this information about non-communicable diseases, the risk factors, is made known to everyone? Okay,
recently at Project Pin Blue, I think October 2018, we organized Pink October in Lagos. No, October 2017. We organized Pink October in Lagos, and we realized that most of the people that came around that were speaking English, and not everybody understands the English language. So one of the incentives was to translate several pamphlets that we have our information on into several languages like Yoruba, Igbo language, the Hausa language. So I think when we talk about the rural area, we can't talk about using social media platforms. We need to go hands-on. We need to be offline. We need to go to advocate to them at the rural level. We need to go teach them, especially on balanced diet. We need to teach them on balanced diet. We need to teach them on, to talk to them on how to stop the use of tobacco. because not only smoking, some of them use tobacco. I learned the elderly use tobacco, they place it on their tongue or something like that. So we need to prevent these things by going out there, going to the, doing outreaches to the villages so that we can have a collective effort on the end to NCDs.
Yeah, as I said, hello, okay. For us young people, either we like it or not, the situation in Africa has warranted that we are fast-tracked into becoming leaders wherever we find ourselves, from our homes to our schools and communities. So of course, definitely we have to take the message to the rural areas, and we at the Wellbeing Initiative, we've been able to do community interventions. We call some of them house-to-house visitations, where we visit a community and we visit the homes, talk to them about NCDs, talk to them about preventive measures, talk to them about the harms of the risk practices. And we talk to them about the consequences of falling victim of NCDs, of course, the out-of-pocket payment they have to go through and all that, the realities of things. So these have helped us a lot to record more community advocates. So basically, it is our duty, young people, if not, we may be having a continent we will not be happy with in the next few years, I tell you. So it is our duty now to take the bull by the horn and get the work done. Thank you.
Thank you very much. We'll now be taking questions from the audience, 2 per section. Okay.
For excellent presentation. Yes, for the sake of this session, those of you peering at me, I'm a senior medical student from Omaha, Nebraska. I think I just want to make a couple of comments and one question. So I think there is a danger in us trying to import definitions here for non-communicable diseases. Yes, the standard burden of disease globally relates to cardiovascular diseases, cancer, and diabetes. What about sickle cell disease? The continent has the highest global burden of sickle cell disease. And sickle cell disease is a recognized risk factor for several forms of cardiovascular diseases, including pulmonary hypertension, which is a leading killer disease. So if we're not paying attention to that, we'll be missing out significantly. And that, again, is a typical example of the dangers in trying to import definitions from elsewhere. So sickle cell disease is not that much of a problem in Europe. It's not a problem that much in the United States. And even in the United States, where we have a lot of blacks, they get screened early in life, and they get adequate supportive care to prevent them from getting that type of complication. So I think for the sake of our population here, we need to redefine non-communicable diseases to include sickle cell disease. I think that's very, very important. Now, in terms of prevention, again, for those of you who think infectious disease is not important, if you are talking about non-communicable diseases, you are wrong. Because a number of those cancers that we are talking about are actually very closely associated with infections. I'll give you just 2 examples. Hepatitis B is a strong risk factor for hepatocellular carcinoma, which is one of the killer diseases here in Africa. We are not paying enough attention to the prevention of hepatitis B. Another good example is human papilloma virus, which is a leading risk factor for cervical cancer. What are we doing about the uptake of vaccines for human papilloma virus? A lot of people think it's something out there in developed countries, we shouldn't pay any attention to it, but it's a leading killer disease here, and there's a simple way to prevent it: enhance and introduce the use of the vaccine. Now, I would also say that there is a lot that needs to be done on the government in sort of developing policies. While I was growing up as a kid, if you are going to buy a bottle of Coke, it's the very small 100 centiliter or 90 centiliter bottle that you have to buy. And yes, it's not everybody that can afford it then, so it's usually a treat. Now you can get the very large bottle that is like about 2 liters. What are we doing to ourselves? How did we allow whatever legislators or whatever legislative system we have in the country to allow that kind of volume to be imported? And it's very readily available, it's widely available, it's a lot cheaper than getting fruits in some places. How did we get to that point? So sushi that you mentioned, for instance, I couldn't believe my eyes when I went out to some of the hotels out here. Young women, young men sitting out there just puffing away. Where cultural standards, our cultural values, what's happened to all of those? And it's a very slippery slope. Out there in Europe, out there in the United States, their healthcare delivery system, they have the resources to take care of these people when they develop the complications. When it happens to you here, you are by yourself.
Good afternoon. My name is Adeyinka. I'm a student of Unilorin. My question is to Dr. Ayobami. Over the course of the session, we've spoken a lot about these risk factors, especially tobacco and alcohol. And you mentioned that these industries are very profitable and so on, and why it's not banned. Now, these industries are profitable because people want these products. And you advise us to go into decision-making agencies and so on and so forth. So, as leaders, how do we make a compromise between giving the people what they want and actually doing what's best for them? Bearing in mind that this is democracy and all that. So how do we make a compromise between, giving them the shisha and giving them what's best for them? Thank you.
Okay, once more, I'm Larissa from Cameroon. My question is, can we strictly say poverty is a risk factor for NCDs? What about healthy lifestyles? Because I feel like poor people, their immunity, they can tolerate certain things, but healthy people, their immunity is somehow depressed due to healthy standards of living, clean environment, and all of that. So can we strictly say poverty is a risk factor for NCDs? Thank you.
Good afternoon. I'm Muganzi David Jolly from Uganda. My question was also similar to hers about poverty being a risk factor for NCDs. We see that in my country, Uganda, even the rich people mostly get these NCDs because they are living in a highly fed state, constant highly fed state. And the question here is to Professor Jean Marie. Does the World Health Organization have a program to do with mindset transformation of people? Because we see that the NCDs, their cause is mainly the lifestyle. What someone does when they wake up, what they do throughout the day, and what they do before they sleep and how they sleep. And we also see that NCDs, we are not looking at treating, but preventing. Therefore, I ask you to let me know if there is something being done so that people start to think of their lives differently, because saying that poverty is the cause of the NCDs, I kind of object that, because I think it is just the mindset that comes with the poverty, because it does not cost someone to do 10 push-ups when they wake up, no matter where you're staying. It does not cost someone to just do a little stretches, to limit the amount of food they take, and also taking alcohol and tobacco. Most of these are caused by the groupthink mentality that is in the youth. Yeah? So are we trying to address some of these? Thank you very much.
My name is Akinagbe Nifesimi from Nigeria. My question is about physical inactivity. And physical inactivity in Nigeria is something that is very widespread, but not necessarily because of laziness or something, because most of the workers in Nigeria are desk jockeys. Like, they work from 9 to 5 behind a desk, then when they are going home, they stay in hurried traffic. So most of the times, they are just on their seat for most of the day. So, and physical inactivity is an important risk factor for NCDs. So I really do not know how we can say we're combating NCDs and we don't have things in place to combat things like physical inactivity that is on a rise in Nigeria. I'm not saying on a rise, but most definitely is a very important concern in Nigeria. Thank you.
Good afternoon. My name is Iyanu Odole, and I'm from the University of Ibadan. I would like to know what part oral health and oral diseases play in NCDs, seeing that some of these risk factors associated with NCDs are also found in oral diseases. So the relationship between oral diseases, because most times people tend to undermine oral health and oral diseases and just focus on cardiovascular diseases and diabetes and all of that. So I really want to know the part of oral health and oral diseases in NCDs. Thank you.
One more question.
Thank you. I'm Kojo from Abuja. I just want to know, everything we've been saying, honestly, is things that I've always known. And I believe 90% of us here have always known. The NCDs, that smoking is bad. Even while we were growing, we were being told. Now, I noticed something in the presentation Prof gave, and it was particularly about simulations, projecting what it would be if it is not taken care of. So I want to see, seeing that projection and bringing facts, telling somebody that, okay, if you keep on resting for years, like 10 years, you don't move, you don't do this, or you're smoking a stick of cigarette or so. Like, there's this common saying that says a stick of cigarettes takes 5 minutes of your life or something like that. Yeah, if we bring simulations like that, I'm thinking of combating it, preventing it now. If we bring simulations like that and take it to the NGOs and whatever, and we take it to our government, to project it to them, to make them see reasons why such factors or such companies should be shut down or reduced? Because I've heard of the situation of tobacco in France and in most parts of UK. My question is, how do we project it to our government? Because I really saw what you did in your presentation and it was nice. Thank you, sir.
Let's take a question from the back. There's someone at the back.
I'm Ishola Esther from Bowen University. I wanted to ask, in Nigeria, the healthy lifestyle seems to be expensive. Let me not say very expensive, because over there, they are free to actually run. I'm just imagining if I decide to run now and I go outside, people will probably follow me because it's not commonplace. It's a strange occurrence. And I know that that's not the case over there. Healthier meals are also expensive. You know, fruits, vegetables, compared to junk foods, quick fixes, snacks, and all of that. So my question is, why is that the case, and what to do to fix it?
Thank you. We'll be starting with Mr. Arishe.
Okay. Let me start with the poverty part. I am not sure if I mentioned that poverty is a risk factor. We were just saying that poverty is a socio-economic factor that can breed the risk factors. For example, she just mentioned the healthy lifestyle to be quite expensive. And if you are impoverished, all you have to think about in a day is, how am I going to eat? I don't think you want to add to your budget gym expenses. So I think it's not a risk factor. It's just a factor, a socio-economic factor that breeds the risk factor. So that's one thing I want to correct. And somebody he commented on the prevention. The effect of hepatitis B and human papilloma virus on cancer, for example. They are infectious diseases that can lead to non-communicable disease such as cancer. And to the best of my knowledge, Project Being Blue is seriously advocating on how to get vaccinated against HPV. And there are serious measures being taken right now on human papilloma virus. Thank you.
Mr. Adebamigbe.
Okay. Yeah. Tochuku. We can now. You were talking about how we can approach the government with all of the facts that we have to take very drastic decisions for the populace, for the people. Well, in case we don't know, the people on the other side of NCDs, as I said earlier, are extreme capitalists who don't care if the whole world is wiped off, so far they sell their products. Now, they don't take it easy on the rest of us. They do everything to make sure that their products are selling. In fact, they even finance research works to make sure that the facts that are available is saying that their products are not harmful. That's how far they go. I visited the office of the Special Advisor to the President on SDGs recently, and I saw that there was a banner in our waiting area which had BAT logo as one of the private organizations in the achievement, working with the Office of the Special Advisor to the President on SDGs to achieve the SDGs. Conflict of interest. You are killing us and you still want to ensure that we are healthy. How? So basically, the facts are there, open, but the powers that be with these capitalists takes a whole lot more collective work. And that's why I said earlier, it's confirmed that tobacco is harmful. Kills about 7 million people annually. Why are we still selling, why are we still producing tobacco? So it's a very convoluted situation that needs a lot of diplomacy, a lot of active consciousness to actually fight. So, but again, don't be discouraged. I found out that shisha was harmful during my master's program, and I went ahead to do a dissertation on it, and I met with stakeholders, and on June the 4th this year, shisha was pronounced banned in Nigeria for the first time. That was recognized as one of the tobacco products. So we could actually still achieve very much more if we come together and, you know, force the government to do the right things. That's on that. Then let me take this one very quickly. Compromising, Yinka from Ilorin. Did I get it? Okay. Compromising between giving the people what they want and what is best for them. In the case, I don't feel that this analogy is applicable to the risk factors of NCDs. The truth is, fine, you can love whatever product you love as a person. We're in a democratic dispensation. But if what you are loving is going to harm me, man, it's a no-go area. I will have to voice out. So definitely, if the people in power actually care so much about the majority of us, then definitely they will be doing what is best for us, not what is best for individuals that want to take tobacco and infect and of course put other people that are not primary smokers into harm. So definitely for the cases about health, I think our leaders must do what is best for us, not to satisfy individuals for what they crave for. Okay, so I think, okay, that'll just do for now.
Thank you very much, Professor JM.
Thank you very much, Zainab. And I would like also to thank all the colleagues for their interest on NCDs. If you look at the number of questions and the number of comments, that means that it's something critical for all of us. I would like first to make a clarification. NCDs, non-communicable diseases, is a group of conditions and diseases with more than 100. And when we were preparing the first ever high-level meeting, we had a consultation in Brazzaville. And at the end of that consultation, we issued a declaration. And the 47 member states in the African region were all on the same page, requesting, when we are talking about NCDs, not to focus only on the four main ones recognized at global level. sickle cell disease is a peculiarity of our region, and it's part and parcel of NCDs, but also other genetic disorders like albinism. We also have mental health. We have violence, injuries, and disabilities. We have oral health. We have musculoskeletal diseases. We have renal diseases. So it's a very big group of diseases. Just for a matter of this panel discussion, we focused on the four main ones at global level, and I said it. My presentation will be a macro one, focusing on what's happening at global and regional level. But you are absolutely right. With regard to risk factors, again, I concur with what you said. The role, the place of infectious diseases in non-communicable diseases in our region is very important. Let's take cancer. 26 up to 30% of cancers in our region are caused by infectious diseases. And that's why even here, when promoting HPV vaccination, we said we are vaccinating against cancer. So on that one, I think we are on the same page. With regard to poverty as a risk factor, I think my colleague already alluded to it. Poverty is part of the social determinants of health. And we said it's an underlying factor for NCDs. And because we are poor, we are more subject to having those bad behaviors, unhealthy behaviors. But we didn't say that poverty is a risk factor. But let's take the other side. Those rich people, wealth is also an underlying factor for NCDs. That's why in the past, we used to say that NCDs is the disease of affluence. We only see it in developed countries, which is not true. There was a question on if WHO is implementing or proposing a mindset transformation program for mindset transformation for NCDs. My answer will be yes, because we are promoting, particularly in our context, we focus on prevention and promotive measures. And when we talk about prevention, what are we aiming? We are aiming at behavioral changes, as we see. Most of the risk factors are coming from unhealthy behaviors. For that, we are using several strategies, like improving health literacy, improving community engagement. We would like to, at the end, people change their way of behaving. Unfortunately, this strategy is not a sexy one. The results are coming in the long run. You cannot get changes in 1 year, 2 years, or even 3 years. 3 years is the minimum. And authorities, national authorities, they don't want things for which they cannot see the results immediately. Most of the time they are elected for 5 years term. So they want results now. And that's why they don't want to invest in prevention. And that's the way we should go. Let's take treatment of cancer. Today, we are going for targeted therapies for cancer. Which country here can afford targeted cancer therapies? So there was also another question on healthy diet. They are expensive what to do. Again, you will find a lot of guidance documents around healthy diet. But again, let's contextualize it. We are not promoting you eating apples because you are not producing apples. So that's one also we should think about it and take what's happening in our context and make it happen using that. But let's also be a little bit optimistic. We cannot reinvent the wheel. Let's capitalize on what exists, what has been discovered elsewhere, and take it from there. Yes, physical activity, that one also is a tricky one. When we talk about physical activity, it's not only jogging or sports. There was a very good example. If you take a woman in a village, going in the bush to look for wood to come and cook. After that, she goes again to look for water. She comes again, cooking, pounding yam, and at the end of the day, did that woman have physical activity? I think yes. So let's again think about it in our context. Just an information, in May 2018, during the World Health Assembly, there was a global action plan for physical activity, which has been adopted by all member states, all WHO member states. You can go and read about it. It's a very interesting one. The last thing I would like to discuss is how to engage with our governments so that they take in board NCD's prevention and control. I will send it back. I will send the question back to you as Nigerian, as people living in Nigeria. What should be your role, your tasks, to get your national authorities consider and act for NCD's prevention and control? They're committed. I show you all the commitments made by our head of states, our head of governments at global level, at regional level, during also the regional committee organized by WHO. But things are not moving at country level. What to do? It's up to you to find a solution. We will come and support you. Madam Moderator, allow me to say last words. But before that, I would like to ask the audience, how many of you during 2018 have had a relative, a parent, a friend, a neighbor suffering from one of the non-communicable diseases or who died of non-communicable diseases? Excuse me, raise your hands. As you can see, it's quite all the room. So it's our business of all. Let's act now. Let's, all of us, promote this multi-sectoral approach when combating NCDs. Let's integrate. And integration is at different levels, including working horizontally with our colleagues from communicable diseases. I thank you for your attention.
Thank you very much, sir. Thank you. That was a very stimulating and passionate discussion that we just had. I appreciate the members of the audience for their attention and for their discussions and comments that drove the pattern of this discussion. And I also appreciate deeply this discussants, our panelists here today. We've come to the end of our discussion this afternoon, but the panelists are still available for further discussion after this discussion. So you can still meet them to have more discussion with them, talk to them, ask your questions, and if you have further clarifications, that can still be made. Thank you very much, everyone. I thank Famsa for giving us this opportunity to have this discussion, as it's very pertinent at this time. Thank you.
Thank you very much. Thank you very much to our speakers and our moderator. I'll be calling on the French interpreter to give a summary of the plenary session for our delegates from the home countries. Thank you.
Bonjour à tous. Nous avons des points notamment et je commence maintenant. Ok. Le thème c'est les maladies non transmissibles. Nous avons il y avait une information par Dr. Jean. Et je commence. Les maladies non transmissibles sont un groupe de maladies. Maladies cardiovasculaires, cancer, diabète et nous avons maladies respiratoires. Ça existe dans le pays avec le standard de la vie de plus mois. Il est aussi relié à l'usage du tabac et de l'alcool. Les femmes ont aussi des rôles à propos de l'obésité aussi. Les pauvres sont plus affectés par les effets de maladies non transmissibles qui mènent à la perte de l'argent et de la vie. Il faut un système coordonné, un système de gestion fort. Il faut aussi un mandat spécifique pour les secteurs pour éviter l'usage d'alcool. Il y a aussi l'usage des formes de produits tabac, comme nous avons dit aujourd'hui, le chicha, qui est très dangereux pour les gens d'aujourd'hui. Nous avons beaucoup de causes de maladies non transmissibles. Nous avons aussi la globalisation, qui est aussi un facteur très important dans les maladies non transmissibles. Nous avons aussi la civilisation qui facilite l'inactivité des gens aujourd'hui. La prévalence de maladies non transmissibles est aussi un résultat de la recherche illicite de la recherche par rapport des capitalistes qui facilitent les produits de tabac au Nigeria, par exemple. Par exemple, nous avons le BAT, British American Tobacco, qui sont les facilitateurs des produits tabac ici au Nigeria. Nous avons aussi, les jeunes ont le rôle à jouer. Et c'est très important pour éviter de fumer et toutes les nouvelles formes de cigarettes. Il faut travailler en collaboration comme étudiants médicaux pour éviter et pour éduquer les gens sur les enjeux des produits de tabac et l'alcool. La pauvreté est une cause principale reliée aux maladies non transmissibles aussi. Et aux faciliter aussi l'inactivité parmi les jeunes. Il y a aussi des délibérations des Nations Unies, mais il n'y a pas des efforts de l'implémentation aussi. Ceci, c'est une difficulté en Afrique. Il faut engager le gouvernement. Par rapport à la lutte contre les maladies non transmissibles. Il faut disséminer les informations utiles vers Internet Et pour les gens dans les régions rurales, il faut les éduquer sur les causes, les effets et les conséquences de maladies non transmissibles. Il y a aussi des autres formes de maladies non transmissibles comme drépanocytose, cancer du col de l'utérus relié aux maladies transmissibles. En conclusion, il faut encourager l'engagement des autorités du gouvernement, il faut encourager l'exercice du corps, il faut intégrer et éduquer la société, particulièrement les youth, sur les causes, sur les effets et les conséquences de maladies non transmissibles. Merci beaucoup.